Welcome to the Policy Engineer Medicare 101. My name is Chris Franchina. I'm one of the co-founders here at Policy Engineer, and today we're going to be taking you through understanding your Medicare plan options for 2026. Let's get started. We're going to be covering a lot today, so if you are new to the Medicare system, I highly suggest you have a notepad handy so you can take notes, pause the video at any time. So before we get talking about Medicare and how the system works, I want to tell you a little bit about Policy Engineer and who we are. Simply put, we are a company that leverages technology in order to simplify the insurance planning process. That's my entire goal with this video. I want to simplify the Medicare system for you. And there's a few other things I want to point out before we move forward. One thing would be our technology. These are really one of the pieces that set us apart from our competition. Our technology, specifically in regard to Medicare, it can make sure that all of your prescriptions are covered. It can make sure that all of your doctors are in network, and it can make sure you're taking advantage of any of the extra bells and whistles that these plans offer are all in the plans that we show you. Now, our process, we have a unique process. We give you the ability to actually self-enroll. You can quote and enroll into a plan on your own, or you can work with one of our licensed Policy Engineer agents, and they can take you through this entire process from A to Z. And last would be our promise. We know that your life's needs are going to change over time. That's why we have a dedicated client success team here that works out of our headquarters in Southern California to make sure you never have to call an insurance company. We are here to do the work for you. Let's talk about our method here at Policy Engineer. As you can see on the screen, this is our stable table. You can see this family, their cars, their house, their lifestyle sits on top of this stable table. And like any table, you need at least 3 legs for your table to stand. And we believe each leg on the table represents a very important piece of your retirement. So one leg on the table is going to represent health. That's what we're going to talk about today. We're going to cover everything the Medicare system covers. We're also going to touch base on what it does not cover. The next would be wealth. If you're going into retirement, there's 2 very important things you want to focus on. You want to make sure you preserve the assets that you work so hard to save over your working years, and you also want to make sure you maximize your income in retirement. And that might be something as simple as finding the best age to start drawing Social Security. And we're going to touch on that today. And the last would be legacy. Ensuring that you pass on your financial legacy to the next generation, and you do it in a tax-efficient way. Now let's talk about me for a second. My name is Chris Franchina. I'm one of the co-founders here at Policy Engineer, and I'm born and raised in Southern California, specifically Huntington Beach, California. I went to Huntington Beach High School, and I'm currently living in Long Beach, California, near the Belmont Shore area. If you're local, let us know in the comments. Now, I am a licensed insurance agent. I've been in the industry for over a decade, so I'm very familiar with the Medicare system. I'm very familiar with working with retirees. And my favorite hobby, anyone that knows me knows I'm a golf nerd. Please, also, if you're a golfer, let me know in the comments. And if you're local, let's go play some golf. Now we're going to get into talking about Medicare, specifically the basics. Who is eligible for Medicare? Well, first, if you're 65 or older, you're eligible for Medicare. Now, you can also qualify early due to a disability. If you've been receiving SSDI, which is Social Security Disability Insurance, for more than 24 months, that's 2 years, you're eligible for Medicare. If you have an illness such as end-stage renal disease or ALS, you can qualify for Medicare, and you do need to be a U.S. citizen or a permanent resident for at least 5 consecutive years to be eligible for Medicare. Signing up for Medicare. This process can seem daunting, but it doesn't have to be. We're going to walk you through the steps right now. First, on the top half of the screen, if you currently have Social Security and you're aging into Medicare, I'm going to read you the paragraph directly from the Social Security website. All right? You do not need to sign up for Medicare. You will automatically be enrolled into Original Medicare Parts A and B when you become eligible. Because you must pay a premium for Part B coverage, you can turn it down. However, if you decide to sign up for Part B later, your coverage can be delayed and you may have to pay a late enrollment penalty for as long as you have Part B coverage. Residents of Puerto Rico or foreign countries will not automatically receive Part B. They must elect this benefit. Again, this is directly off of the Social Security website, which is ssa.gov. If you do not have Social Security when you turn 65, you're going to have to sign up for Medicare. And if you do decide to sign up, here's how you're going to do it. One of these 3 ways on the screen. First, you can apply online. You can go to ssa.gov That is the fastest, simplest way to sign up for Medicare. I highly suggest taking that route. All right, now the second option, you can call into Social Security. The number is 1-800-772-1213. I'm gonna give you a little tip. If you're on the West Coast and you're watching this video, if you're calling Social Security for any reason, try calling later in the day. The hold times are gonna be a lot less. The East Coast callers are probably calling it a day. Now, last option, you can go apply in person at your local Social Security office. Another tip, call the Social Security office before you go in. Get an appointment scheduled. It's gonna really shorten the wait times when you get there. Speaking of Social Security, what you're seeing on the screen right now, this is the full retirement age chart for Social Security. Now, if you don't know what full retirement age is, that is the age at which a person may first become entitled to full or unreduced retirement benefits. Now, this depends on your birth year. Now, most of you watching this are probably turning 65 and you're going on to Medicare for the first time. If that's the case, then your full retirement age is going to be here in this bottom bracket. If your birth year is 1960 or later, then your full retirement age is 67. Now, most people don't know this, but you could have taken Social Security early. You could have taken it at 62. But if you took it at 62, you would have up to a 30% reduction to your benefits. There is a wide range from taking it at 62 and deferring all the way to the maximum age, which is age 70. If you waited until 70, you would actually get a deferral credit of 24%. That is a really big difference, which shows making the decision on when to start drawing Social Security is very important. Now, we do help folks with that decision. And now at the bottom of the screen, there's something I want to point out that, again, most people don't know this. Social Security, it actually does have a death benefit. It is $255 in a lump sum only payable to a spouse. That is not a lot of money. That is just enough maybe to cover your gas tank twice, maybe, depending on where you live. So one question you need to ask yourself, if you're married and you're relying on 2 Social Security incomes, what would your legacy plan be if one of your Social Security payments were to go away? Now we're going to focus on the 4 parts of Medicare. People call this the alphabet soup. It can be confusing, but we're going to make it really simple today, okay? So first, I want everyone just to focus your attention on the top half of the screen up here. You can see you have Parts A and Part B of Medicare. This is the government coverage. All right, so first let's go over Part A. This is your hospital coverage. When you're paying taxes into the Medicare system, you're paying into Part A of Medicare. This covers your stay in the hospital. Now, then you have Part B of Medicare. Part B of Medicare, this is your medical insurance. Now, we're going to go in more detail on both Parts A and B, but Part B of Medicare, simply put, it covers 80% of your medical expenses at the doctor or the hospital. Part B, it does have a monthly premium. For Part A, as long as you've worked for 10 years or 40 quarters, you're going to have Part A at 0 monthly premium. Part B of Medicare, it does have a monthly premium, and it's based on your adjusted gross income. Now, let's focus our attention on the bottom half of the screen. So notice on top, I said 80% is covered by Part B of Medicare for your medical expenses. Now let's look at private insurance and how this situation works with the other 20% that Medicare doesn't cover. So that would bring us to the first option for your insurance plans that go with Medicare, which is a Medicare supplement insurance plan and a standalone prescription drug plan. So a Medicare supplement plan, it covers the other 20% that Part B does not cover. So you have 100% of your medical covered when you have a Medicare supplement plan. Then you would get a standalone prescription drug plan to cover your medications. The supplement plan does not cover your prescriptions. You would get a standalone prescription drug plan to satisfy your Part D coverage. So if you go with this option here, you're going to have Part A and Part B as your primary. They're going to be the first to get the bill. Then your Medicare supplement takes over and pays the other 20%. And then your Part D, that's what you would take into the pharmacy to get your prescriptions filled. All right, now let's move to the other option, Part C. This is where people can tend to get confused. It would be very simple if Medicare worked in this order and it was Parts A, B, C, and D, and it just worked like that. But it's a little different. So Part C, this is what's called a Medicare Advantage plan. Medicare Advantage plan, it's like a combo plan. It's going to be a combination of Part A, your hospital coverage, Part B, your medical insurance, and Part D, which is your prescription drug coverage, all bundled into one plan, which is going to make up a Part C Medicare Advantage plan. Most of these plans are HMO plans. They do have multiple types. Some are PPOs, but something that's really important to recognize when you have a Part C Medicare Advantage plan, your primary is no longer original Medicare. Your primary becomes the insurance company. So now they are going to dictate your availability to doctors, what the benefits on the plans are, what the copays are going to be, what they're going to charge for your medications. The insurance company is going to decide that. All right? Typically, they're going to have a network. So you may have a medical group assigned to your insurance, you may have a primary care physician assigned to your insurance, and you may need to get a referral to see somebody outside of your primary with this system. There are pros and cons to both that we're going to touch on today, but that's a really important decision you need to make when you first go into Medicare. So this page really gives a better visual at your two insurance plan options you're going to have when you go into Medicare. Just to recap what we talked about on the last page, original Medicare. This is one of your options here. If you go with having original Medicare as your primary, you're going to have Part A, which is your hospital insurance, Part B, your medical insurance, and remember, this covers 80% of your medical. You do pay a monthly premium for your Part B coverage. Then you would add a Medicare supplement insurance plan. The Medicare supplement insurance plan also has a monthly premium. This is going to cover the other 20% that Part B does not cover. So you're going to have 100% of your medical expenses covered here. And then it doesn't cover prescriptions, so you would get a standalone prescription drug plan. Now, the biggest perk to having this combination, if you have original Medicare as your primary and a Medicare supplement, you can go to any Medicare-appointed doctor in the entire United States. And you're going to be able to call directly to the doctor's office. You don't have to get a referral. All right, so this is one of the options. You're going to pay a little bit more for it, but it gives you total freedom. Now let's talk about the Medicare Advantage plans. Also very appealing. The Medicare Advantage plans, we talked about that combo plan. It's going to be a combination of Part A, your hospital coverage, Part B, your medical insurance, and Part D, your prescription drug coverage, all bundled into one plan. Now remember, when you go with Part C, the insurance company becomes your primary. So it's really important to make sure that your doctors are in network, your prescriptions are covered, and you're taking advantage of some of the extra bells and whistles that they have with these plans. One thing you're going to have, we talked about open access here. When you have a Medicare Advantage plan, because they're your primary, they're going to let you know what doctors you're able to see if you're in this plan. So you want to make sure the medical group you assign to this insurance plan has your doctors in it. And you want to make sure all of your prescriptions are covered. All right, so far we've covered the macro of how the Medicare system works. Now we're going to zoom in. We're going to focus on each part of the Medicare system. So let's first talk about Part A. This is your hospital insurance. Part A, as long as you've worked 40 quarters in the US, you're going to get Part A at 0 monthly premium, and it's going to cover your inpatient hospital care, skilled nursing facilities, hospice care. It's also going to cover limited home health care. So here's the cost breakdown. And before I go over this page, I want to point something out. If you have any insurance plan at all, whether it's a Medicare Advantage plan or a Medicare supplement plan, they're typically going to cover your hospitalization. If you just had Part A by itself and you didn't have any insurance, these are some of the charges you may see. So first would be a deductible. In 2026, the Part A deductible is $1,736. Then you have your hospital coinsurance. For your first 60 days in the hospital, it's $0 for that benefit period. From days 61 through 90, $434 per day. And from days 91 through 150, $868 per day. Now, skilled nursing. This is something that's really important to talk about. Skilled nursing, your first 20 days in a skilled nursing facility, it's $0 for that benefit period. But from days 21 through 100 in a skilled nursing facility, it's $217 per day in 2026. And then from days 101 and beyond, all the cost then goes to you as the patient. Now, depending on what type of Medicare plan you have, the charges may be different. Medicare supplement insurance typically covers you up to the 100 days at $0 out of pocket. Your Medicare Advantage plans, they're going to range widely between how much you pay of this $217. So it's something you want to look at when you're looking at Medicare Advantage plans. And no matter what plan you have from day 101 and beyond, all costs then go to you. So that's typically when we start to have a conversation around this. This would be long-term care. Long-term care is not covered by Medicare or traditional health insurance. What long-term care is, it's a range of services and supports you may need with your personal care needs. It is not medical care. Typically, when you need long-term care, it means you're unable to perform 2 of your activities of daily living, such as bathing, dressing, using the toilet, transferring incontinence, and eating. If you're unable to perform your 2 of these on the list, then you may be deemed needing long-term care. So now, how do you protect yourself against long-term care costs, and how do you plan for it? This is something that's really important to do. If you're beyond Medicare's limits, you want to understand how it works. So one of the options, the 4 options that you can choose to cover long-term care, one would be self-insure. You can use your own money, your own nest egg, to create an income stream to pay for your long-term care. That would be self-insuring. The other option, you can get an insurance policy. Leverage the insurance company, put the risk onto them, let them create an income stream to pay for your long-term care. The other option would be VA benefits. Depending on the criteria you qualify for, Depending on the criteria you qualify for, it's going to range between what type of long-term care benefits you get through the VA. And lastly here, government aid. If you're on Medicaid, or if you live in California and you're on Medi-Cal, you can get long-term care coverage in a facility. These are the 4 options to pay for long-term care. So we talked about the 4 ways to pay for long-term care, but now let's go into the actual costs of long-term care. These numbers are in California, so if you're somewhere else in the country, it might be a little less, but let's look at the first option, which is a nursing home with a private room. It's just over $146,000 per year for a private room. Now, assisted living facility, just shy of $80,000, and then this would be your most popular option. Most people want to be cared for at home. If that's the case, just over $80,000 per year is the average. These are 2025 numbers. Now, let's look at the average lifetime cost of care. How many years you need long-term care is going to range widely. It all depends on the severity of the situation. So the average lifetime cost of care in 2025 is $435,000 for your lifetime cost of care. Now, if we inflate that by 3% and we round up, it's just over $910,000 if we look forward 25 years into 2050. So it's very important to plan for long-term care. One, because traditional health insurance does not cover it, Medicare does not cover it, and 7 out of every 10 people will need care at some point in their life. So now, if you have a notepad out, I would actually answer these questions on a piece of paper. This is going to help you with your planning. If you are beyond Medicare's limits and you need to have the conversation about long-term care, these questions are really important to ask yourself and start planning early. First is, where do you want to be cared for? Would you prefer to be cared for at home or in a facility? Now, the second question, who do you want to do your care? Do you want your family to actually take over and be doing the care? Or would you want professionals to do the care and your family is there more to oversee the situation? And another question, on a scale of 1 to 5, how important is it that your family is not associated with paying for the care itself? Do you want to remain independent in making sure you cover the cost of care if you're in that situation? And the last question I want to touch on about long-term care, and this again, really important. This is going to show you how susceptible you are in retirement if you needed long-term care to depleting your nest egg. You need to know the answer to this question. How many years could you self-fund the cost of care? If we just round up to 100,000 and we count inflation, how many years could you pay for home care or facility care out of your own pocket until you would have to rely on somebody else? All right, so I want you to write that down on a piece of paper. These are really important things to know and incorporate that into your planning. All right, we talked about long-term care. I know it's not the most exciting conversation, so we're gonna go back into part B. This is your medical insurance. All right, so this is gonna cover, again, 80% of your medical expenses are covered by part B of Medicare. Now, this is going to cover your doctor visits and preventative services, outpatient surgery, diagnostic screenings, emergency care, even durable medical equipment. Things like wheelchairs, canes, walkers, etc. are going to be covered under Part B of Medicare. That's not a complete list of all the services. In general, if it's a medical expense and it's accepted by Medicare, 80% is going to be covered by Part B. We talked about Medicare having a premium. Now we're going to talk about how do they calculate that premium, and you need to know this because every single year this calculation is going to take place. So in 2026, they're going to be looking backwards 2 years. They're going to be looking at your tax return in 2024. And they're going to be looking at what's called your modified adjusted gross income. And that's going to determine your premium. Every single year, they're going to look backwards 2 years. So when you sign up for Medicare, don't be alarmed. If you're working and you have a high income and you go onto Medicare and you're like, man, I have an increase to my premium because of my income, it may go down in the future. There are certain strategies you can take to make sure you're not getting that increase to your premium every single year. All right, but they're going to use your modified adjusted gross income. Now, they're going to look at things like your interest, dividends, capital gains, rental income, and tax-exempt interest are all going to be part of the equation to figure out what is your Part B premium. So here's the chart, the Part B premium chart. We've been waiting for this to come out. In 2026, the standard premium for Part B of Medicare is $202.90. Now again, they're going to look at your 2024 tax return to determine this 2026 premium. Here are the brackets, and I'm going to break this down a little bit. If you file taxes jointly, you and your spouse, if you make $218,000 or less in 2024, then you're going to be here at this $202.90. If you file as an individual and you made $109,000 or less in 2024, then you're going to be here at $202.90. If you fall anywhere else in these brackets and you made above that in 2024, you're going to see an increase to your premium. So what I want you guys to do, I want you to pause the video. I'm going to step off screen for a second, and I want you to write down your Part B premium. All right, hopefully you took a moment and you wrote down your Part B premium. And again, don't be spooked. If you did have an increase to your premium, it may go down because they're going to reset every single year. All right, now on this page, we have to talk about late enrollment penalties. Make sure you sign up for Medicare in time. We're going to touch on this later, but just to mention it right now, you're going to have a window to sign up for Medicare. If you're not on your employer coverage and you're deciding to go onto Medicare, you're going to have the 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65 to enroll into the Medicare system. Now, if you do get a penalty and you sign up for Medicare late, for Part B, specifically, the monthly premium for Part B may go up by 10% for each full 12-month period that you could have had Part B but did not enroll. And with any of the Medicare penalties, once they're assessed, they are permanent throughout your entire life. So you really want to avoid any type of a penalty. Now we're going to touch on the Part D penalty. That's your prescription drug coverage. Now, there is a penalty that would be 1% of the national base premium, which in 2026 is $38.99. And they're going to multiply that by the number of full uncovered months you were eligible for Part D, but did not enroll. So this takes us to a really important question. Most of you probably have health insurance coverage through your employer, and you're wrestling back and forth. Do I stay with my employer plan, or do I go on to Medicare? One thing you need to know, if you do decide to stay on your employer plan, and you do have what's called creditable coverage, all you would need to avoid a penalty is a form that proves you had creditable coverage. Even if you're beyond 65 and you're way beyond your initial enrollment period, whenever you leave the employer plan, just make sure you get that form and you can show Medicare that you had creditable coverage and you will avoid a penalty. Just to recap so far what we've covered, original Medicare generally covers 80% of your hospital and medical expenses. What does it not cover? We touched on long-term care. Here's a few other things. It doesn't cover your deductibles, co-pays, co-insurance, outpatient prescription drugs, healthcare outside of the United States, and then also other things like dental, vision, hearing, chiropractic, acupuncture, transportation, podiatry. Those are not covered by original Medicare. But some of the insurance plans may cover these. That's why it's really important to remember these tiles, remember everything we've talked about so far when you're going to look at your Medicare insurance plans. Now we're going to get into talking about the insurance plans. I'm sure a lot of you have been waiting to get to this point, but first we're going to start with the Medicare supplement insurance plans. If you're seeing TV commercials and you're seeing the word Medigap thrown around, Medigap and Medicare supplement insurance are the same thing, all right? So let's go into it. Original Medicare does not cover your deductibles, co-pays, co-insurance. We touched on that, but the supplement plans, they do. Depending on what plan you may have no co-pays, you may have no co-insurance, and no deductible, depending on the plan, which I'm going to touch on that in a second. You have freedom to choose from any Medicare appointed doctor in the entire United States. To me, that's probably one of the biggest perks of having Medicare supplement insurance. And what makes these plans very, very simple to shop for, they are all standardized by their plan letter. I'm going to show you a chart in just a moment. Every single insurance company that offers Medicare supplement insurance, the medical benefits are identical. They're exactly the same. So you're really making sure you find a creditable company that has a competitive monthly premium. So now we're looking at the Medicare supplement chart. Again, every single insurance company that offers Medicare supplement insurance has to follow this exact chart. And highlighted in gray on the left-hand side, this is everything we've talked about already. So far, we've talked about Part A, your hospital coverage, Part B, your medical coverage, your blood work, hospice care, skilled nursing facilities, Part A deductible, Part B deductible, Part B excess charge, I'll explain what that means in a second, and even foreign travel. So now, highlighted in blue, these are the most popular Medicare supplement plans. So we'll go down the line here. Plan G, it covers essentially 100% of everything we touched on earlier. Your Part A, your hospital coverage, your medical, your Part B, your blood work, hospice care, skilled nursing, Part A. One box is missing here, and that is the Part B deductible. The Part B deductible in 2026, it's $283. Once you've paid that deductible, you essentially have 100% coverage outside of the board, and you have 80% foreign travel for emergency. Then we get to Plan N. Very similar plan. It covers 100% of everything we talked about earlier. There's two boxes missing here. One, again, is that Part B deductible. That's $283 in 2026. And your Part B excess charge. Part B excess charge, simply put, this is when a doctor is able to bill 15% over Medicare's approved amount. So let's just say it's a $300 doctor bill. They can bill an extra $45. The excess charge, to be honest, it's very rare that these happen. But one thing with the Plan N, I want to point out, there's 3 stars that you can see here next to the copayment section. With a Plan N specifically, in the doctor's office, you may have up to a $20 copay and up to a $50 copayment in the emergency room with the Plan N. So if you do decide to go with this plan, if you're constantly or if you're frequently going to the doctors, you may see some of these copays and that may start to add up. Now you're probably wondering, these are very similar. What's the difference in the cost? Depending on where you are, it ranges. It's going to be anywhere from maybe $30 to $50 per month. You want to make sure you work with a broker that has great technology that can show you most of the plans that they offer, so you really get a good idea of what the pricing is. But again, remember, the insurance companies, they're all going to have to offer the identical benefits. Again, you're going to want to find a credible company at a competitive rate. One quick reminder, Medicare supplement insurance plans do not cover your prescription drugs. You can get your prescription drugs through either a standalone prescription drug plan or if you have other credible coverage. All right, now we're going to cover the Part D prescription drug coverage. This is usually the most complex part of the Medicare system, so I encourage you, pause and take notes if you need to. All right, let's break it down. Prescription drug coverage, you're really going to be able to get it in one of 2 ways. If you get a Medicare supplement plan, you're probably going to get a standalone prescription drug plan. And if you have a Medicare Advantage plan, typically it's integrated into the Medicare Advantage plan. With Part D, you must be enrolled in Part A and or Part B, and you need to live within your plan's service area. Now we're going to go over the stages to the prescription drug coverage on Medicare. Used to be 4, now it's 3. So if you've heard of this thing called the donut hole or the coverage gap, it is gone. All right, so we have 3 now. First stage of the prescription drug coverage is going to be the deductible. The deductible, that's what you pay out of pocket for your prescriptions until the insurance company kicks in. The deductible range in 2026 It's anywhere from $0 to $615. This is one of the reasons why you really want to investigate your prescription drug plan before you go on. The last thing you want is to have the maximum deductible and then go to the pharmacy in January when the year starts and get this astronomical cost at the register. You want to avoid that. So just make sure you look at your out-of-pocket costs before you enroll into a plan. The deductible, $615 in 2026. Then, after you've met the deductible, or if it doesn't apply, you're going to go into stage 2. This is your initial coverage. All right, so this is essentially at the register, the copay that you're paying for the medication. It's going to range widely between insurance plan. Look and investigate the insurance plans for prescription drug coverage heavily before you go on to Medicare. It's one of the most important things you can do. All right, something that's new that just got put into place when the donut hole got taken out, it changed a lot of things. So that made it where we now have a limit. You have a maximum out of pocket for your prescription drugs. In 2026, the maximum you can pay for prescriptions, as long as they're in the formulary, is $2,100 for the year. Once you've hit $2,100, then you go into the final stage, which is the catastrophic coverage. After you've reached your $2,100 MOOP, maximum out of pocket, then you have no copayment and no coinsurance for the rest of the year. The insurance company is going to take over at that point. Something I want to touch on really quick is the Part D Extra Help program. It's a low income subsidy. It can help with your prescription costs, and you may qualify as long as you're within these parameters here I'm going to read off to you. So let's first start with your assets. If your assets are not worth more than $35,130 as a married couple, you may qualify for extra help, or $17,600 as a single individual. This is your assets. Now, your income, your annual income, needs to be limited to $31,725 for a married couple, or $23,475 for an individual. And if you want to see if you can qualify, the link is listed on the screen. I know it's a really long link, but you can let us know in the comments if you want us to send it directly to you. It's on the Social Security website. You can apply for the Extra Help program. All right, now we have gotten to the Part C Medicare Advantage plans. These can be very complex, so we're going to make it simple. Really simple to understand. Remember that combo plan we talked about earlier. It's going to be a combination of your hospital coverage, that's Part A, your medical coverage, that's Part B, and your prescription drug coverage, that's Part D, all bundled into one plan. So when you do get a Part C Medicare Advantage plan, you're telling Medicare, I don't want you guys as my primary. The insurance company is going to be your primary. That's not necessarily a bad thing. There is incentive when you have a Medicare Advantage plan for them to make sure you do have managed care, which is why you're going to work with a medical group. You're going to have a primary care physician assigned to your insurance, and they're going to make sure they help you get referrals to go see specialists and get the good care that you need. But one of the cons with that is that you will most likely need to get a referral to see somebody outside of your primary care physician. And I tell everybody, if you're going to go onto a Medicare Advantage plan, the most important thing you can do is make sure your doctors are all in network before you join the plan. You don't want to have your plan start and then you go to your doctor's office and realize they don't take your insurance. It is extremely important to make sure your doctors are in network and also that your prescriptions are covered under this Part C Medicare Advantage plan. Now we're getting to the enrollment periods. Most of you watching this, you're probably turning 65, trying to figure out how the Medicare system works. Well, let's talk about your initial enrollment period. This is a 7-month window that Medicare gives you to sign up for Medicare, or else you get a penalty, and you want to avoid the penalties. So your initial enrollment period, it's going to be 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. All right, now that brings us to the annual enrollment period. From October 15th through December 7th, every single year, you're going to get the opportunity to make changes to your plan. And you can make as many plan changes as you want. The last change you make becomes effective on the 1st of that following year. Okay? Then that's going to bring us to the open enrollment period. It's not really marketed, but the open enrollment period, it does exist. It's from January 1st through March 31st. Simply put, if you have a Medicare Advantage plan, this is typically the time where you can make a change from one Medicare Advantage plan to another Medicare Advantage plan. I'll give you an example. Let's say during the annual enrollment period, you switched your plan. You went to a Medicare Advantage plan. Then January comes around, you get your cards, you go to the doctor, and you realize, man, I do not like this plan. Don't panic. You'll have an opportunity to make a change from January 1st through March 31st. You're allowed to make one change during this period. All right? Then from April 1st through December 31st, this is the lock-in period. This is where you can't really make any changes unless you qualify for a special enrollment period. These are special circumstances during the year where Medicare will allow you to make plan changes. One example, if you're on an employer plan and you decide mid-year, I really want to leave this employer plan, or maybe your employer eliminates the plan, you're going to get a special enrollment period and you can go on to Medicare, pick the combination of plans that you want to go on to, okay? Then, this is state specific. Not every state offers this. In California, where we're at right now, they have something called the Medicare birthday rule. The Medicare birthday rule is going to allow you to make changes to your Medicare supplement insurance policy around your birthday. So if you have a Medicare supplement plan, right around your birthday, typically 30 days before and 30 days after, you may be able to change from one Medicare supplement plan to another, as long as it has equal or lesser benefits. Now, why would you want to do that? Because the Medicare supplement plans, they have monthly premiums. And if you ever find a letter in the mail that comes in and says, hey, your premium is going up to this amount, around your birthday, you're going to have the opportunity to shop plans without going through any of the medical underwriting at all. So speaking of medical underwriting, Medicare supplement plans specifically do have medical underwriting. Now, what is medical underwriting? It's a list of medical questions on the application for insurance. And if you say yes to one of the medical questions, there is a chance you could be denied the coverage. But lucky for you, there is a Medicare supplement enrollment period. You have 6 months. You have 6 months from when you join Medicare or turn 65, whichever is later. You'll have no medical underwriting, and you can choose from any of the Medicare supplement plans available. So earlier we touched on the special enrollment periods. I want to touch on the Medicare supplement guaranteed issue situations. So you have your supplement window, your enrollment period. You have that 6 months after you turn 65, but you can also get into a Medicare supplement at different times. Now, one would be loss of coverage. Here's an example. Let's say your employer plan, it's kaput. They don't have it anymore through your employer. Well, you're going to get a special enrollment period, and you'll have what's called guaranteed issue rights, where you can get into a Medicare supplement plan with no medical questions. Another example, moving to a new area. Let's say you have a Medicare Advantage plan and you live in Los Angeles County, and then you decide you're going to move from Los Angeles County to San Diego County. Well, you just moved out of the network of the original plan. So once you're now in San Diego, you're going to have the option to look at a Medicare supplement plan. All right, so these are just a couple of examples of some of the special enrollment periods and guaranteed issue rights that you can take advantage of. I would highly suggest, if you're making a big life change, reach out to your broker, or you can reach out to us and see if you qualify for a special enrollment period. So here's something you really want to pay attention to when you're looking at insurance plans, and that's going to be the star ratings. If you're like me, before we go to a restaurant, you're going to look at the reviews of the restaurant, right? You may even be crazy like I am and look in the comments, see what people are saying about the restaurant. But you get a similar opportunity when you're shopping for the insurance plans. They're going to have star ratings. They're going to be based on a lot of different factors, but to me, most important is going to be member satisfaction. You get to look and see how the other experience was of the members on that plan before you join. All right, get the notepad back out, because we're going to start going over the consumer buying tips for Medicare supplement plans, Medicare Advantage plans, and prescription drug plans. I would take notes on all of these as we go through. All right, let's start with the Medicare supplement plan tips. If you go with the Medicare supplement plan, I know we've touched on this multiple times, but do not overpay. The benefits are identical across the board on the medical side, so you just want to find a credible company with a competitive rate. Don't miss your guaranteed acceptance periods. Because the Medicare supplement plans have the medical underwriting, take advantage of the times where you don't have to answer any medical questions. Maximize all of your discounts. Most people don't know, but you can find discounts for your Medicare supplement insurance. And I'll give you a few examples. One would be if you agree to pay on the auto pay system. If you're letting them just debit your card, sometimes you'll find you get a discount. You may also get a discount by paying annually. If you pay the year up front, some insurance companies will give you a discount. And the last one I want to touch on is the household discount. Some insurance companies will tell you if you and your spouse go into the same insurance company in the same Medicare supplement insurance plan, they may give you a discount. Something I would definitely look at. And last year, check for extra benefits. Yes, the medical benefits are exactly the same. You may find that some of the Medicare supplement plans are going to offer some extra bells and whistles on top of that medical coverage. Now we get to the Medicare Advantage plan tips. Very, very, very important that you focus on this first one and the second one. So first, make sure your doctors and hospitals are in network with your plan. All of them, your primary and all of your specialists and any hospitals you want to have access to, make sure they're in the network with the Medicare Advantage plan before you enroll. And last here, make sure your prescriptions are covered. Not only make sure they're covered, but make sure the copays are competitive. You really want to have an idea of what you're going to pay before you go into the pharmacy. And last here, review the plan's maximum out-of-pocket. It's called the MOOP, but this is the most you're going to pay out of pocket with that plan. So take a look at that. They're going to range widely between insurance plans. And lastly here, we're going to the prescription drug plan tips. If you got a Medicare supplement plan, chances are you're going to get a standalone prescription drug plan. And here's what you want to know. First, know the total annual cost. So it's very common for people just to look at the monthly premium of the standalone prescription drug plan. You want to know what your total estimated cost is for the year, counting the copays at the pharmacy and the monthly premium. Know what your deductible is, add all of that up. Now, if you're working with an agent, make sure you ask them about the technology. There is really great tools and softwares available now where you can look at all of the plans that are out there on the market, and you can pre-predict the cost before you start the plan. Not all formularies are created equal. So because your neighbor or one of your family members has a plan, it doesn't necessarily mean that's the plan that you should go with. Because if you take different medications, the formularies are different. The copays you pay will be different than somebody else. Preferred pharmacy status. This is a big one. It's often overlooked. The insurance companies, they often have partnerships with pharmacies. Try to look up to see if there is a preferred pharmacy. You're going to find that you'll get discounts or you'll pay less at the pharmacy for your medications. And down here, use discounts and coupons when advantageous. Now this is no ad, we have no affiliation with them, but I would definitely leverage a system like GoodRx. If you're paying an arm and a leg for your medications, look to see if there is a discount or a coupon available through a company like GoodRx or one of the websites like that. I'm all about saving money on your prescriptions by all means necessary. Now I want to touch on our service to you. If we are lucky enough to earn your trust and you're working with some of our policy engineer insurance agents, here's what you can expect. We do multiple annual plan reviews. Plans can change. We want to make sure we update your plans as your situation changes. We do premium increase strategy calls. If you're on a Medicare supplement plan and you got a letter in the mail that says your premium is going up, we want to help you avoid that. We have a dedicated client success team. They work here out of our headquarters in Southern California. They will make sure that you don't have to call a 1-800 number and dial into the insurance companies. We will do that work for you. We will handhold you through the process. And then you're also going to get access to our technology. So our brokers, our agents can walk you through the process, walk you through the technology, or you can get sent the link on your own. You can look at the insurance plans. You can even enroll into the insurance plans on your own. You can make sure your doctors are in network, your prescriptions are covered, and you get to see all of the extra bells and whistles that these plans offer, all in one centralized place. So whether you're working with one of our licensed policy engineer agents or you're using the link which is in the description below, here's some of the basic information we'll need to make sure we find a plan that fits your specific situation. One, we want to know when you start Medicare. That's going to dictate when your plan's most likely going to start. We want to know the zip code you live in because the pricing really is based off of what zip code you're in. We want to know the primary doctor and any specialists you see so we can ensure your doctors are all in network with any plan that you see. And if we know the medications you take, we can pre-predict the cost. You'll know exactly what you're going to pay at the pharmacy before you go in. And then we want to make sure you're maximizing your needs. Any of those yellow tiles we referenced earlier in the presentation, if there is something that will benefit you, we want to make sure you're taking advantage of that with the insurance plans. All of this is available in the technology that we use. All right, now that concludes the presentation. That's the end of the Medicare 101. I know we covered a lot of information. And if you have questions, what I want you guys to do is click the link below in the description. We will make sure we get you in touch with one of our licensed agents so they can help you answer the questions. And we have a ton of free resources if you want to just do some research on your own. We have really great articles on our website. We have a ton of information in our knowledge base. Click below. Hopefully we get the chance to talk to some of you guys soon, and share this video with someone who needs to see it, and subscribe and stay tuned for more.